video, uh, which is going to talk about the deviated septum surgery I had and my experience recovering from it and how I feel. So it's been about a month, and so far I feel great. And this is one of the best decisions I think I took in my life to actually get this surgery done. And maybe I should have got it done sooner. Um, so we're going to go back and check some of the. I'm going to show you some of the videos which I did post-op, also pre-op, and my scans, and then towards the end, I'll leave you with some words of advice, with based on my experience, what I've learned from the surgery, and hopefully that'll help you make the decision whether to get it, or whether to get it or
Okay,
not in
so the
whatever stage of
first
life
picture which
you're
I
in.
wanted to show
All
you
right,
guys
so hang
was
tight.
um, the picture of my septum. So this is something I just took using my phone. And as you can see here, the left side here is very constricted. You can literally see like there's a small opening at the top here for air to flow in. And as compared to my right side, which is all, wide and open. And honestly, in all my life, in my, teens, 20s, 30s, I was always able to breathe much better from my right side, right? My left side was always kind of like blocked, and I always felt congested because of this issue I had. The other video which I have is right. Well, let's look at my CT scan. So this is something you had to get, otherwise your insurance wouldn't cover it, and your ENT has to definitely diagnose you whether you really need a surgery or not. So in my case, as you can see, um, the septum is pretty badly deviated. It's to the left, and you see these two big blobs which are called turbinates, and they kind of shrink that as well as part of the surgery. So I think they straighten the septum, and in most cases, from what I understand, there is a turbinate reduction done towards the end as well. Now the septum itself, I think they take about 70 to 80% of your cartilage is kind of gone, and then they leave the remaining 20% to support your bone structure, and your nose on top of the bone, and then they suture back your basically septal mucosa. So that's sutured back, and then they put splints inside for the next 5 days. Um, the other thing is, yeah, so the splints, they don't tell you about the splints. I'm going to show you guys how those splints look like. So this is what comes out at day 5. It's pretty gross, and actually, trust me, like there's when you look at it, you're kind of thinking, how the hell did that even fit in my nose? And I had no clue that this, something like this was put in for 5 days. um, I'm going to show you a video after this of how I felt on day 1 and day 3. Hopefully that gives you an idea of the post-op recovery, and then towards the end, we'll talk more about the surgery in itself, and my
Okay, so that
experience
is basically
with it.
my first day post-op. How I felt. They put you down under. Hey guys, this is the third day. Well, actually, it's technically I had my surgery, deviated septum surgery, on Thursday morning at 7, and this is like Saturday evening now. So, been full 48 hours. I'm super congested, and I think the bleeding has stopped, but I've been doing some saline rinse. Uh, Tough to sleep at night. I had a painkiller last night, but then I've been managing without any painkillers. And there's a lot of drainage in the back of my throat. So if you're someone who has allergies, or in general your nose is runny, think twice before you get this surgery, because you want to be like 100% fit. You don't want any drainage or too much drainage, because the splints are just going to make it nearly impossible for you to breathe. Right, guys. So I hope you enjoyed those clips I played, and some of the scans and pictures I showed you guys. It's been about 30 days after my surgery, and as I said, like I feel super great. I'm grateful that I had the insurance, I had a great doctor, I got this done, and I've been thinking about this for maybe 6, 7, 8 years now. And I was constantly taking Afrin, which was a nasal spray to sleep. I had sleep apnea. I used to get sinus infections almost every year. Every time I used to get a cold or like a flu, it would be very severe for me. It would take about 2, 3, 4 months to recover back and feel normal. So if you're someone suffering from all these symptoms, you should definitely consider getting the surgery. The only word of caution I would have is for people who are much younger or who have a sports career. If you are someone who is playing contact sports, I would say don't get this now. Wait till you're towards the end of your career, just because they do remove a big piece of your nasal septal cartilage, which I think gives you a bit of confidence when you're out there. Because I could feel that I have this thick bony septum inside, and even if I'm playing basketball or anything, and I get hit, I get injured, no problem. I just felt that it was very strong piece of bone inside, or the cartilage was actually very strong. Now the outside bone is there, which is all good, so it doesn't change the shape of your nose, but you do feel a little less confidence when you're out there and you're playing any sort of contact sports. But for someone like me who's sitting behind the desk, I don't play a lot of contact sports. I do go to the gym, I swim, I play tennis, I bike. For all of that, this is perfect. Get it done. Don't even think twice. But only if you're a little younger and you potentially think you might get hit, then I would say maybe consult with your doctor before you rush to get the surgery. But otherwise, it's been super great. Leave me any questions down below, and I'll sure to come back. I love you, and have a good day.